What happens when two of the most plugged in people in digital care team up to help you make sense of the chaos? Welcome to Control Plus Care. I'm Michelle.
And I'm Katie.
This is your weekly briefing on the most important digital care updates. We're unpacking what you need to know this week in under 30 minutes.
We're in the countdown to Christmas. So, just to say, we'll be taking a break from the podcast from the 22nd of December to the new year. Just 2 weeks, and then we'll be back.
First, Katie, how are you?
I'm pretty well, thank you, Michelle. I am currently up in Scotland, did manage to make it through Storm Bram. So, anybody who wanted to do the West Coast Railway during that, terrible idea, wouldn't recommend. But otherwise, good. How are you?
The leggy has got me.
Yeah,
It's got me big time.
I know. Just before your holiday as well.
I know, and I was just like, this week, if I have it all this week, give me all the leggy you can, as long as next week, so I can frolic in the snow, I am
Mhm.
good. So,
Yeah,
my fingers crossed.
exactly. And actually, that is probably a good point to say, do not worry, we will be doing a podcast next week, but I will have a special guest co-host joining me who will announce themselves as a surprise while Michelle is off in the snow.
Oh, so that would be really good. But first, let's deal with this week. So, my first news story isn't a news story, really. It's one of our announcements. As a lot of you know, a few weeks back, we announced that the programme had been recommissioned, the Better Security, Better Care programme, supporting adult social care providers with everything they need around cybersecurity resilience. So because we launched this, we thought it was a really good time for us to take a little retrospective and look back at the last 4.5 years and everything that we've achieved in that time. So we have published our latest impact report, and honestly, it's come out as one of those things where we had to go back and check when we were pulling out the figures of things that the program's achieved. It was phenomenal. So,
Mhm.
for those of you that don't know the program well, you probably come across us in terms of like things on our website and seeing us at events. But essentially, the way it operates is we have a national team at Digital Care Hub, but then we work with 28 local support organisations, which is what we call them in the program. But in fact, they are local care associations.
Mhm.
And for the past 4.5 years, they have been hand-holding providers through the DSPT, through their fears, their worries, their concerns, and all of the things that they don't get about cybersecurity. And we've made such a meaningful transformation in the sector that it's just incredibly heartwarming. We pulled together all of our stats because obviously we've been counting everything that we do over that time. And it turns out that in the last 4.5 years, we've delivered as a program over 10,000 webinars and online workshops, 15,000 hours of 15,000 one-to-one sessions delivered, which equates to over 60,000 hours of support, and another 50,000 hours of engagement with care providers, local stakeholders, and all the various partners across the sector. And it's just, when you think this has all been done free at the point of receipt for the sector,
Mhm.
it has been done by people who really understand the sector. You know, we work with care associations because they're experts in social care. What we've done is given them the expertise in cyber. We've developed over 100 partners across the programme, and our helpline has delivered over 14,000 hours of helpline support. So in terms of real engagement and real actual help to the sector, it's enormous, and we're so proud of it.
It's just been a phenomenal effort from everybody. And, sometimes I get asked, oh, but what happens if some people haven't heard of you? Like, what do you do? And I'm just like, gosh, I feel like we're at everything we possibly could be with those hours. So, yeah, just a huge congratulations, I think, to everybody who's been involved in the program. And the change in the sector in terms of how many people are now completing the data security and protection toolkit and what that means, just phenomenal stuff.
Yeah, so we're really proud. Go and have a look at our impact report. And if you're interested, go on the website and you'll be able to find your own local support organisation.
And I think that probably also leads quite well into the next story, which is probably our meaty one of this week. So this is the latest ministerial announcement from Stephen Kinnock, who's the Minister for Care. and the government about sort of next steps around digitisation in social care. So there's lots of articles that we will link in the show notes about this. So I'm kind of picking and choosing across a few of them to kind of pull out the main highlights. But nearly all of them call it the digital revolution in care, which I actually think is quite nice. We speak a lot on this podcast about the journey the sector has been on and where we've come from. And obviously, the headline figure of this announcement is that now 4 in 5 care providers are using digital social care record systems. But that's about 80% of the sector, but actually that covers about 90% of all people who draw on care and support and now have a digital care record, which is just phenomenal when you think about the comparatively low scale of investment in social care comparative to sort of like the NHS major digitisation programs. And I really think that the Digitising Social Care programme has done a great job here in terms of really supporting the sector. And some of the headline sort of figures and benefits, I mean, like I think anyone listening to this podcast is probably aware of most of the benefits, right, around digital care records. But the ones that they pulled out is that they estimate 30 million admin hours will be saved per year through using digital care records across the whole sector, which is just kind of crazy. And when we're talking about those sort of hours saved, I want to be really clear. This is not that you can cut 30 million hours of care work. We're not replacing carers with these systems. What it means is that time, which was originally would have been spent, writing up notes at the end of a shift, doing all of the manual auditing of paper records and those things which can take a lot of time, can actually then be put towards providing direct care, meaningful support, that social connection, which is so vital in the sector. So that's estimated as approximately 20 minutes per care worker per shift, which, 20 minutes might not sound like a lot, but actually 20 minutes of meaningful time can make huge, huge differences to people. Other things which potentially could be benefits of this. So there is some evidence which is coming out in evaluation that using digital care record systems can mean that care plans can be completed and signed off in 3 days on average, as opposed to 7 days. And also that reviews can be reduced to as little as half an hour rather than taking 4 hours in some of the sites which were part of this evaluation. So, some real meaningful difference here. That's sort of where the sector's got to. Probably the bit which is like, it's nice to see, but we'd heard sort of similar figures before. But there were sort of some new announcements, I think clarification about things that we'd heard at the beginning of the year. So all the way back in January, the government announced that their plan was that the adult social care provider sector, so CQC registered providers, would be fully digitised by the end of Parliament, which sounds great, but all of us were like, okay, but what does fully digitised mean? Because, that's a fairly nebulous concept at this point. And obviously there had to be a lot of consultation about this. Like, I'm not blaming the government for not knowing everything straight off the bat back in January. Like, we needed to understand what a sensible approach was for the sector. And I know they did a lot of background work on this, but we do now have an answer. So a fully digitised care provider has to meet 2 specific metrics. So one, which I'm sure Michelle is delighted about from better security, better care perspective, is they need to meet standards met on the Data Security Protection Toolkit. And the other one is they must be using an assured digital social care record solution. So those are the 2 metrics for care providers listening. Check if you're doing both of those things. You might be like, yep, done. But I think it's quite interesting to see that's, where the government is aiming for. There is some things I think that we probably should talk about that in this context. So an assured solution, for people who aren't aware, is one which is there's 21 of them. They're listed on the Digitising Social Care website. They've been accredited by NHS England assurance teams to have met minimum standards, core capabilities, cybersecurity functions, and also committed to a roadmap of data standards over time. So some of those are like GP Connect, for example, and I believe it's about 5,000 care homes now who have access to GP Connect directly through their digital social care record. There are obviously, though, other solutions which are on the market which are not assured for a variety of reasons, right? It's not mandatory to go through that assurance process. But my understanding is that 80% figure I spoke about at the beginning is sort of any care provider using any kind of digital social care record. So if we're moving to only assured solutions will count, potentially we'll see some reduction in that number in the shorter term. I think we don't want to get like too worried about that as a sector. I think really this sets out a bit of an idea. If you are currently using an unassured solution, start having those conversations with your suppliers, right? Are they planning to go through that process?
Mhm.
And if not, it might be worth looking at your contract terms and sort of like what's happening at end of contract. Do you need to be thinking about moving to a different solution because of all of the other stuff we're going to get onto about why it's helpful to use a shorter solution? Other things I think sort of from this is I think it'd be fair to say fully digitized could mean so many things to so many people. And while it's great to have clarity, I know for some of the more innovative providers that I speak to, they probably are going, oh, but what I do all of this and more, right? So it
Yeah.
does fully digitize. Like, I don't think it means that we can stop as a sector. We can't just say, okay, well, I've got a care record solution and I've done the DSPT. I'm done. We know there is so much more technology out there. We know there's a variety of things like EMR, IoT, like consumer technologies, a range of different sensors, so much which is coming onto the market all of the time. And so I guess I would like to encourage any care organizations or people working in social care to be looking at the broader picture, to think, okay, if I've got a DSCR, that's my baseline. I think Daniel Casson once called it like the beating heart of your digital infrastructure as a care provider. What else can you do now? Is there more value that you can be getting?
I think that's the thing, isn't it? Always remembering that any guidance that comes out of the government or the department is aiming for a baseline. Um, in care, we're not trying to deliver baseline. I'm trying to deliver really good, high quality care, and that tech and digital is increasingly a really effective tool to help you as a provider do that.
Yeah, exactly. So, yeah, this is definitely this is sort of a minimum baseline. This is not a stop at that sort of
Hmm.
thing. Um, but the bit which I think is really, really interesting, and why care providers should be thinking about moving to assured solutions is we talked back in our episode all about the 10-year plan, about the single patient record and
Yeah.
what that means. And, the movement in the NHS for each of us, every British citizen, to have a single record, which we would have access to, which covers all of our information. And it was always, we said back then, and it was quite unclear how social care was going to tie into this. And this is what we think is going to be the next step. It sort of says that the plans is to understand how assured solutions can connect into that single patient record. That's part of the discovery work that's happening next in this program.
Hmm.
So to sort of think about that longer trajectory about what's best for people with care and support, how can we make sure that the vital information about them also is included in that single patient health record. That's kind of where the importance lies around having an assured product because you don't want to miss out on that opportunity. I was speaking to a couple of care providers recently who were talking about supporting people with learning disabilities, working age adults, and the importance of like the hospital passport and about me and about how they have that in a digital format, things which is important to that person, but they worry that that doesn't necessarily get picked up if that person is in hospital, for example, or is going to the GP. This is a way that we could start thinking really meaningfully about where can that information automatically going and being visible to another health and care professional who's providing care at that point of care. Some of that join up is possible. And I know I at least have been talking about this forever, and I'm working on like a 50-year timeline for when I might need to be in a nursing home and getting this sorted. But it feels more in reach than it ever has before. So I think that's quite exciting.
I think it's really exciting, especially because we think about ourselves as like, I think it's really easy for us all to think about ourselves as patients of the health system because we don't have care needs yet, but we are living longer with multiple comorbidities. The quality of that end of life
Mm.
is increasingly relying on quality care. And I want that story, it's obviously a really, really long time to land there because I'm so young. But I want that
We are
story,
both
thank
so young, so
so
young.
young, just children, basically. But when we get there in the next century,
Hmm.
I want that entire story of my health to be
Yeah,
added. And if it, as you say, it feels now meaningfully like that might happen.
yeah,
But it does rely on us making decisions around our systems that has that future in mind.
yeah.
Very often you're buying the system that you need now, And I think increasingly as a sector, we need to be thinking about the system we might need in 3, 5, 10 years
Yeah.
because they're really difficult to retrofit some things. So security is a really good example. I'm so pleased to see the commitment to the DSPT. Obviously, we have worked really hard to push numbers up, but we're not at 100%. We don't have every provider. We have most. We're at 76%, sorry. So we've got most providers have a DSPT. The second question for me is, how meaningful is that? And that's what the program's going to be working on next. But that commitment to secure by design, put the security foundations down before you do the digital development, seeing that commitment is really heartening. And for providers, it's about the journey of both things. It's about making sure that your security is in place and then that you're choosing the system that you're going to need today, tomorrow, and in the future.
Yeah, exactly that. And I know people might have some questions about all of this sort of thing. There's loads of FAQs on the website. I've gone through the ones for care providers, but if you are also a software provider, there's a full FAQ for you, full FAQ for commissioners as well. But some of the ones I know I immediately looked for when I saw this. So, what happens if I'm not fully digitized? So the government's line on this is that they want to support care providers to make the transition. So there's no immediate penalties for not being fully digitized. But I know they do say no immediate penalties. So maybe a watch this space sort of moment. How will the Department of Health and Social Care know if a care provider is meeting the fully digitized metrics? So good news. No care provider is going to have to do new data returns because I know we all love to complete data returns. So, from a DSPT perspective, that's already captured within the DSPT. The numbers are all there, lots and lots of clarity. So, all you need to do is publish, and the government knows that that's fine. And then all of you will be doing capacity tracker. I'm sure you've already noticed that there is a question about digital social care records in there. That will continue to be the place where that is how you will notify the Department of Health and Social Care. So, yeah, no changes there. I'm sure we are all relieved. If you are a care organisation who has created your own in-house DSCR, that's absolutely fine. Like, obviously, there's lots of reasons why it might be more appropriate for a care provider to create their own solution than to purchase one off the shelf. What they're really recommending is that anybody who's bespoke built their own product should be talking to their IT and dev teams about assurance and contacting NHS England's assurance team directly. All of the links are in the FAQ on how to do this. To start having conversations as early as possible about also meeting those assured standards so you don't miss out on some of those interoperability opportunities as they come forward. So that's sort of the bulk of all of the announcements. There's a couple of other interesting things, some more information, for example, about the care tech standards, which were also announced. Really thinking through about how we can identify which pieces of care technology will be most beneficial and how people could be signposted to those. Probably quite a small list in the short term, but really thinking about from the perspective of an individual, and that's how it will be prioritized. So I think that's really interesting. They've also explicitly said that this might include consumer technology, not just sort of the purpose-built social care specific stuff. So lots and lots to go through. I do apologize for the number of links that Rihanna is going to put in the show notes for everybody, but quite a raft of different announcements we've been waiting on this week.
Yeah, and that's the thing. We've been waiting for this for a long time, and it's really nice to see it out.
Yeah.
And I'm really interested now to see what is the sector's response because you and I live in this space, so we talk
Yeah.
about it all the time. If you're a provider who, digital is part of your world, but it's not your world, I'm really interested to see what their feedback is. Does this make any difference to you? Do you think it's something that's a benefit? I think there's a lot of conversations now that the announcement has been made to be had around that.
Yeah, definitely. And let us know, leave a comment, get in touch with
Mhm.
us. Be
Yeah,
great.
fabulous. Thanks, Katie. Well, staying on the theme of governments and tech, my next story is a really short one. I'm sure nobody missed the budget announcements in the last.
Yep.
uh, We all saw the budget, but one of the announcements in there was 300 million for tech for the NHS, which social care adjacent. Always nice to see the investment, and as we've just said, a lot of the movement for health and social care is about bringing them together. So that kind of investment in healthcare very much is going to have a knock-on effect in social care. Um, but one of the things that we've kind of noticed in the conversation that's developing around it is a lot of that money is actually capital spend. Now, for those of you who don't know the workings of government money, you have revenue and you have capital. Revenue obviously is ongoing. You can hire your staff, you can build services, you can, create long-term vehicles for things. Capital spend is you buying things off the shelf, you're getting things built. Capital in like the traditional sense is you're building a new hospital. In the tech sense, it's you buying the product. Um, that obviously doesn't translate to a lot of the development work that people have been talking about, and particularly this idea, the that we're going to roll out AI on a really large scale.
Mhm.
So AI's coming, we're going to throw money at it, but actually, a lot of the money that's been committed to tech spend wouldn't be applicable for that kind of thing. So there are questions as to whether that's going to delay the rollout of AI. I would raise the question of whether that's necessarily a bad thing.
Yeah, it's not necessarily a bad thing to delay that, obviously. So, we shall see. And also not just AI, I guess, a lot of sort of SaaS products may well not fall within this. So,
So interesting that, these big numbers sometimes come along, but there's strings.
yeah, of course there are. So, and this is one that I actually had missed in the budget. So it was sort of like a last minute article that came across and was like, oh, okay, yes, I should probably have picked that up. But
In fairness to you, Katie, there was a lot in the budget
there was,
to see.
yeah. And
Never
yeah,
thought about social care, funnily enough, but certainly enough
we're
to catch our
still not a
attention as
political
citizens.
podcast.
No, we're not. Um, we're blaming the cold and flu medication.
Yeah, fair. So, final story this week, because we've been very England focused, I think, with the ones that we just been talking about. So, this is one that I found about Japan, which we have talked about Japan before. And obviously, they have an aging population there. Um, and this is an article called Japan is facing a dementia crisis. Can technology help? On BBC News. And it had genuinely one of the most shocking lead lines I think I've ever seen. Like proper clickbait, but like it's not clickbait because it's true. But I'm just going to read the line in its entirety because I think, Michelle, you're going to be like really astonished by this as well. So last year, more than 18,000 older people living with dementia left their homes and went missing in Japan. Almost 500 were later found dead in a year.
That is, as someone with a family member who regularly goes missing,
Yeah.
the idea of that at that scale is horrifying.
Horrifying. You just sort of, I read it and just sort of had to sit with it for a moment because somebody who's like, I worked in dementia care for a long time. I also cared for my grandmother who had dementia, a lot of experience around this space. But when you see the scale of the numbers, just unreal.
And for almost a third of them to meet an untimely end.
Yeah. It's, I mean,
That
500 people with the dementia in a year to have wandered and then be found dead is crazy. And then 18,000
imagine
living.
that with any other issue than dementia.
I know. I know.
Any other population than old people.
I know. So obviously, Japan recognizes it's a huge issue. Otherwise, there wouldn't
Good.
be an article about it. So they have some kind of interesting ways that they've been using it. Some of these things I have seen in the UK as well. So especially adoption of GPS-based tracking systems. So to kind of keep track of people who go missing or who wander, sort of thing. Some regions in Japan, these GPS systems are linked into sort of their local authority equivalent to do immediate alerts if people go outside of a particular precinct or area so that it's easier to find them. And in some towns, and I think this is kind of lovely in some ways. So in some towns, convenience store workers receive real-time notifications if somebody's gone missing. So it makes a community safety net that can locate a
Yes.
missing person. And, if you think of like the Dementia Friends
Hmm.
movement in this country, like actually what a nice thing to say, like this is a dementia friendly cafe, like, and be linked into some of that community support that could
I
be there.
I actually love that, and I'll tell you what. So my mother-in-law, I've spoken about previously, has dementia and often will leave the house and get lost. And the convenience stores are always the first port of call for the police.
Yeah. Yeah. That's really fascinating, isn't it?
Mm.
And obviously, an article about Japan. There's lots of talk about robots in here.
Mhm.
And this is now, a robot friendly podcast, notoriously. We've never said a bad word about a robot.
Love robots.
We do. But there is a really cute one, which I hadn't seen before, actually. So it's called Pocketomo. And it's literally like a cute little bear looking thing, which can fit into your pocket, but it can give medication reminders, it can give alerts, like sort of some of the stuff that we've seen in this country, products like Genie or Sentai, for example, who can kind of help as a companion robot as well, but pocket-sized, which is adorable.
I mean, that's very Japanese.
Very Japanese. I mean, like, I don't know if I'm pronouncing Pocketomo correctly, but
It's
I
almost like Pocketomo and you're the Tamagotchi.
yeah. Oh my God. But it's cute. I would recommend looking at the photos on the
I'm
article. If
down
nothing
for it.
else, yeah, it's sweet. So yeah, I think that's our main news articles for this week.
Okay, well, that does bring us to our favourite one.
I'm
So,
such a big one.
after the news stories, for those of you who are new to listening, we have a segment called Cyber Squirrels. And it is our opportunity for a light-hearted, fun tech story that usually, but sometimes, isn't related to social care. So Casey, what have you got for me this week? Because they're always so good.
This is so good. I enjoy this one so much. And I need to say a very special thank you to Dan Plummer, who sent this one in for me. It was like, oh, I thought you might like this as Cyber Squirrels. Yes, I do like this as a Cyber Squirrel. And I think Michelle is going to really like this one too. So this is a whole website, which is santaprivacy.com. And somebody has created a privacy policy for Father Christmas.
People are wonderful.
It's
Like,
so good. Obviously it's really long. I can't go through the whole thing, but I'm going to just pull out some of my favorite little bits of this. So the first section sets out the identity of the controller, the legal nature of Santa, and the overall premise. It also explains that Santa operates through several entities that may act as joint controllers or service providers or contractors, and these include the Department of Elf Surveillance, Reindeer Logistics and Aviation Command,
obviously,
Elf Data and Intelligence Office,
want to work for them.
and Krampus Enforcement Limited, which it notes only in certain cultural regions they are responsible for coal and similar symbolic consequences.
We can't navigate GDPR through Brexit, and somebody has figured it out for Santa.
It's literally so good. They also talk about some of the data that they collect is called behavioural telemetry, which is data points relating to an individual's conduct, including but not limited to helpfulness, sharing behaviour, tantrums, adherence to bedtime, kindness, bullying, honesty, and similar indicators of naughtiness or niceness.
I'm getting this printed out for my kitchen.
Oh my God. And then final one, because I couldn't not. They have defined IoT as Internet of Toys, means connected or sensor-enabled toys, ornaments, or other Santa-branded devices that collect, process, or transmit data to Santa.
Again, we can't figure out Internet of Things and social care.
It's so good. I would really recommend having a read through the whole thing. I laughed the whole way through.
For those of you who don't know, I'm going to Lapland to meet Santa next week, and I'm so glad to know that he's got all of his policies in place.
Absolutely. Not just for the
great
UK,
comfort.
but EU-wide. Also covers Californian data privacy laws. It's very clear.
I mean, I don't know why I'm surprised that Santa has got all of this taken care of.
Of
but
course.
that it's available on the internet.
Well, transparency is obviously very important.
I love the world.
I know. So, Merry Christmas, everybody. Santa's covered from a data protection legislation perspective. So, to all parents who have been obviously sending in their annual reports of child behaviour, fine. You're not breaching any laws by doing so.
Thank God. Fabulous. Well, thank you so much. They're always good, but that one was excellent and seasonal. So, that's the end of episode this week. Come back next week when we'll be discussing the latest digital news in care. So, what happens when two plugged-in people team up to demystify digital care? You get Control Plus Care.
Subscribe now wherever you get your podcasts. All of the links mentioned today will be in the show notes.
And tell a colleague, especially if they're planning their own digital revolution.